Briefly, post-traumatic stress disorder, or PTSD, is a psychiatric condition that occurs when somebody is exposed to a significant life trauma. Either they were traumatized themselves, or they witnessed or became aware of trauma happening to somebody else. And usually, what happens in this case is the person develops coping strategies that are sort of to deal with the traumatic experience, but are ineffective in day-to-day life. Coping strategies and therapy are really important when it comes to understanding how to address post-traumatic stress disorder and gambling disorder. The general consensus is that when you're dealing with somebody, a client who has both of these issues, you should be addressing both the gambling problem and the trauma at the same time. We've done research on post-traumatic stress disorder and trauma over the past couple of decades. But over that time, there's been a growing number of research projects that has looked at gambling in addition to either experience of trauma or experience of post-traumatic stress disorder. And I think to be able to put that into perspective of sort of where we've come from to where we are now, I think will be really, really interesting. In addition to that, I'm going to present on just how little research there is in terms of treatment research out there. There's really only a couple of small pilot studies, but I will be able to at least talk a little bit about a study that we've been doing over the past few years, where we've been using Lisa Najevitz's seeking safety model to address co-occurring gambling and trauma among problem gamblers in Canada. Seeking safety is a cognitive behavioral treatment approach for looking at both gambling problems and trauma. So the idea behind this is that it gives people sort of a sense of what are the factors that affect their gambling related to their trauma, and also gives a sort of a safe place for both the client and the clinician to sort of explore how that affects their addictive behaviors.